With Dr. John Idoine, who is giving me help with his last name, Idoine. Did
Perfect.
I say that all right?
Perfect, absolutely.
Nailed it. Well, good morning to you, John. How are you?
I'm doing great. Great to be here.
I'm glad that you're here. I've heard rumors of you, like the new shoulder guy in town.
Well,
I know, and here you are. Very pleasant surprise. Shoulders.
Yes.
How many times do people injure? I mean, is this a common injury?
It's actually a lot more common than you would think. We get shoulder injuries all the time. This is our kind of our busy time of year with all the skiing that's going on. Right. People are getting them injured. It's also a joint that is prone to injury because unlike the other joints in your body, you have a tremendous range of motion. And the cost of that is instability. So a lot of people can develop instability, right. And there's a lot of moving parts in the shoulder.
It out and
well, yeah, I mean that at the end range, you know, there's instability to the point where people are grossly unstable. But there's a lot of moving parts in the shoulder because unlike the knee, which you can imagine has a more refined and constrained range of motion, the shoulder can go all around, and there's a cost to that. So
being a very complicated and frequent injury, the spot of injury, what made you get into doing shoulders?
Well, you know, that's an interesting question. I had two really great mentors when I was in residency who were fellowship trained shoulder surgeons, and I just found myself being on their service a lot. They really mentored me and guided me, and I saw the amazing things that they were doing and inspired me to go on and do it myself.
That's amazing to be able to open someone up, and we'll talk about different procedures in a second, and help fix them so they can live the life that they want to live. So that's pretty cool. Where are you stationed here in North Conway?
So my wife and I are living up. Well, I'm for work.
For work. Don't give out your personal address.
So for work, I'm up at Memorial Hospital, and we're doing great things there. The orthopedic department is wonderful. There's Dr. Taylor, who
he just set my kid's arm.
That's right. He's a staple of the community and does great things with total joints in the knee and the hip, and does a lot of trauma work. And Dr. Glazier, our fellowship-trained sports doctor.
Yes, I've seen him as well.
Yes.
We've taken full opportunity of Memorial Hospital here with my family, so it's glad to have you on board, though. When did you come on?
We got out here in September.
Great.
So I started in September.
And where are you from?
I'm from Ohio, Columbus area.
Nice. And you've been in Ohio for most of your upbringing as well as your fellowship, correct?
Yes, all of my training was done in Ohio.
Okay. And what brought you to North Conway?
Well, you know, it's funny. You know, there was an opportunity here. There was a need for a person to come in and do some of these shoulder procedures. And my wife and I had a trip up here, and we thought, wow, what a wonderful place to, raise a family. Yeah. And there was a need, and so we decided to come here.
Well, welcome. Very good to have you here in the Valley, and it is a great place to raise family. And you guys actually are upping the game for Memorial Hospital and everyone here, because now we can get this kind of care right here in the Valley.
Exactly.
Now, you brought in some models, which I have to admit, when you walked in, I thought they were hip bones, and that's how that's how bad I am with that. But they're not hip bones. They're shoulders, obviously. You know,
the reason I brought these in was just to kind of maybe show the viewer the different types of surgeries that are possible in the shoulder. I'll begin with just this. This is a normal model of a humerus bone.
That looks so big. Is that typical?
Yeah, this would be probably average size for a male.
Smash.
So when you have a shoulder injury and something that you've discussed with your doctor that may need surgery, you go down one of two routes. There's the arthroscopic route, which means small poke holes around the shoulder where you insert a camera and different long instruments through these portals, and you do the reconstruction from an outside-in approach. You're actually not even looking at the shoulder, you're looking at a screen while you're doing the majority of the procedure.
So less invasive, but I imagine it depends on the injury what the best procedure is.
Exactly, so there's limitations to it. But to be honest with you, the arthroscopic surgery has really developed, and there's amazing things that we can do through these tiny portals. I just wanted to give the viewers just a quick example of how this works. So I would enter this anchor. This has really revolutionized shoulder surgery because you can put these anchors into the bone.
Oh my.
Right, and I'm hoping this works. Okay. And then what you can do, if you can hold it, I'll just undo these. So what happens is, in surgery, you put the anchor into the bone. Now, you pull this out, and then these are the sutures that we then use to pass through the cuff for a rotator cuff repair, or through the labrum to tighten up the shoulder, all done like this.
Wow.
And then as this attaches through the tissue, then you tie the knots on top, and it can all be done through poke holes. So the reason I brought this is just to show you that these are the small implants that we can put in when we do arthroscopic surgery.
That's amazing. Your body doesn't reject having string in.
No, it's all you know, well monitored and sterilized and non-reactive to the body for the most part. I mean, there can be issues with that, but
and probably
it's
the
very rare.
downtime for a patient depends on their conditioning and all that stuff. You must see a wide range because everybody falls, especially when you're skiing, ice skating. You said it's a busy time.
Sure.
So if someone's having shoulder problems, when should they see a doctor?
You know, that's a good question. And I think what a reasonable answer is when a reasonable amount of time has not relieved the symptoms. So, you know, a few weeks, if it's still bothering you, if it's something that's nagging you, you've tried rest, you've tried anti-inflammatories, you've tried icing, and you're still having discomfort, then you might be worried that there might be something more serious going on. And of course, the risk is that you avoid it, and then something that is relatively small, doesn't need surgery, then develops into something that would need surgery.
Okay. And does PT come into play before and after surgery, or when does that?
Yeah. Physical therapy is great on both sides of the coin. So there are many conditions that don't need anything more than some focused physical therapy and some guided exercises to focus and strengthen that area. And then after surgery, I depend on physical therapy because that's the flip side of the shoulder. Although it has the most range of motion, it also can become very stiff after surgery. So I really work closely with the physical therapist to guide them on their therapy so that they are reaching the goal so that they don't develop a stiff shoulder. Because the ultimate goal at the end is for them to be able to do this again.
And do the things they love.
Exactly.
And that's why they came to see you in the first place. And these models are beautiful. So will you just tell us real quick on what's
I just
going
wanted
on
to
with
show people, shoulder arthroplasty, which means replacing the shoulder, is something that I've, a newer service line that I've brought to the community. And I just wanted to show, so this is what a normal humerus looks like. Okay. It has a round part, which is your articular surface. It's the ball of the ball and socket joint. Okay. And so when this becomes worn and the cartilage becomes damaged, we can put in a metal replacement, and you can see that the round part is here.
So just this metal part replaces?
Just this metal part.
Okay.
So we remove the articular portion. There's a stem that goes down into the humerus to anchor it. And then what's important is this round part becomes replaced with a metal round part that won't wear out with time.
Right. That looks so smooth and shiny.
Exactly. You can imagine the pain relief that you could get.
Oh, my goodness.
So the problem with this is that this shoulder requires your rotator cuff to be intact in order for it to function. So although we can replace the articular cartilage, if your rotator cuff is damaged or diseased from degeneration, you won't have the function that you would want after surgery. So that created an interesting dilemma for shoulder surgeons for years. They would operate on the shoulder, they would replace the damaged cartilage, the pain relief would go away, but the patient didn't have good function. They couldn't really lift their arm. Until one day, someone decided to do something pretty crazy. They decided to, and I'll just show you this, instead of putting the ball where the ball is typically placed, they turned that into a cup.
Go ahead and hold those right there and we'll get a shot.
So you see here, they turned it into a cup, and where the cup used to be, they turned into a ball.
Okay.
So the idea of this is that
so they reversed it.
They've reversed it, and that's exactly what it's called. It's called a reverse total shoulder.
Was that like a light bulb moment?
It was a light. Well, to be honest with you, it went through years and years of failure, and people thought that people were crazy for doing this, and the French and the surgeons in Europe are really who pioneered it. And so they made several. Where this would fail would be on the ball side because there's so much force going through it. But the newer implants have a base plate that gets screwed in, and then the ball gets put on over top, and it's much more secure. And so now it can handle the forces that go through it. The main point that I know that this is technical, but the main point, a reason you would want to have this is for a shoulder that has arthritis and doesn't have a functioning cup. If you don't have a cup or a functioning rotator cuff, the deltoid, which is that big muscle on the outside of your shoulder, is powerful enough to elevate your arm. So anyways, this is a game changer, and the indications for this have grown tremendously. It used to be we'd only do it for people who had a rotator cuff tear, but now we do it for fractures. So it's an up and coming thing.
Wonderful, and now you have provided this right here in the Mount Washington Valley.
That's right.
In Memorial Hospital. So that's wonderful stuff. Well, thank you so much for coming to the Valley. It was a pleasure meeting you. I've heard great things about you.
I appreciate
How
that.
do people get in touch with you?
Well, they can call obviously the Memorial Hospital hotline, or main line, and they can get routed to our office to set up an appointment. We're happy to see anyone who's interested to come or needs us.
Wonderful. Well, John, it was a pleasure meeting you. Dr. Idoine, he's now at Memorial Hospital doing shoulder surgeries and whatever else you need, of course. John, thank you once again.
Thank you for having me.
All right, folks, we'll be right back. We have Laura Cummings, White Birch Books, is going to be joining us.